How does technology help combat those disparities? How do we see technology closing that gap?
I mean, I think we've talked a little bit about digital sort of medicine, digital therapies. I think that there's also a place in putting digital tools into doctors' hands. And I think giving them quantitative information, and this is maybe Daniel can speak more to this because he writes a lot about this in his book, but surfacing quantitative information as context could lead to more objective outcomes, I think, in certain ways, where it's like, well, like you've diagnosed it this way for this patient, but this is what we think you would have said if the patient had done exactly the same things and they were male instead of female, or something like that, based on all the statistics that we've done on your decision making so far. I think those kinds of tools would be really interesting to look into.
Mm-hmm. I would love to have those tools. I'm trying to develop something like that in our lab here. And the primary reason why I'm personally interested in them is my skills as a clinician wax and wane depending on what time of day, whether I'm caffeinated well, whether I slept well the night before. And, I had twins, or my wife had twins 8 months ago yesterday. And wow. So the sleep variability is a significant factor. And so being able to have a way to operationalize what it is that I think is important, not even looking for new information yet, right? Just right now, can I articulate what I think is important? And can I make sure that I have the checks and in my clinical work to survey those things every time? Yeah. Right. That's a huge lift. And in some ways, standardized note taking through electronic medical records is trying to do that. There are certain things that clinicians look for at every visit in order to be able to create a billable encounter. Right. So that's one thing that we as a discipline have decided should be checked every time. But then in every discipline, there are other factors that you're supposed to look for. And so having tools to identify that information, make sure I check that information, and also synthesize that information in the correct way at the correct time, I think would be hugely valuable.